hoping you can all see my screen in the next moment or so, if anybody can confirm. Yeah. Brilliant. Thank you. Okay, so this is the population dashboard. It all comes through on the WSIC Population Health Analytics Tableau site. So as you can see, this is a web-based site using a URL and user access point. You will be able to come and see a number of different dashboards in WSIC, but the one that we are particularly interested in today, of course, is the Frailty dashboard. So there's a little symbol here that will take you into the dashboard in more detail. And when that comes, and when you click on that, it will bring up this dashboard, this view of some of the data around the frail population. This particular view is all about the population. The frail population is based on using EFI and looking at any person who has an EFI score that relates to either them being mild, moderately or severe frail within that EFI score. So it's taking from the whole population and removing those who have a score of fit and leaving everybody else in. And we can see from our key KPIs at the top what our total frail population is, mild, moderate and severe breakdown. And there's a number of graphs underneath that was to give you a little bit more information. But then what we want to try to look at today is how can this then be used? So the first thing that we want to see is we've got this filter here for health births. So this dashboard, of course, has been created for just Brent and Harrow. So if you're working in Brent's area, you can choose to look at Brent. If you're working in Harrow, you can choose to look at Harrow, and it will then filter to just that applied area. So these are patients who are registered to the GP practices within that borough, not residential within that borough. Okay, so that's a key piece of information about who that frail population is. And then there's a number of other filters along the top, so you can choose to slice and dice this data in whichever way makes most sense for each individual using the dashboard. Whether you're looking at this from a PCM point of view or individual practice, if you're only interested in those who have a moderate or severe frail score, again, you got that. You got gender, ethnicity, deprivation, and as I'll show you then as just a very quick overview of how this works. So if we remove all of the deprivation deciles and choose our most deprived areas. So now I'm looking at anybody who is registered to a GP practice in Harrow and living in one of our most deprived locations. Applied that, all of these numbers are going to update, all the bar graphs are going to update and change to display that information. So now looking at that, obviously I have reduced this down to a much smaller cohort of individuals. We can see over the past year, so taking our current, sorry, from the 12 months previously, how many people were newly met those frail conditions, so the EFI score of 5 or more in the last 12 months. Then on each quarter following, how many additional people have met that who are newly frail, in probably better terms for explaining that. And then we got our total sort of numbers, how they're growing over time. Then we got, of that frail population, it's split by ethnicity. We've already chosen our deprivation decile, but as we can see, the majority there are in decile 2, but of that quadrant quartile there, we've got 1 and 2 there. Age band split by gender, number of those with a long-term condition, and how many long-term conditions too. So we can actually see that the majority of this frail population have 2 or more long-term conditions. So not only are they marked as part of this frail population, but they also have multiple long-term conditions. And then of those, what are those long-term conditions? What's the largest prevalence of long-term conditions within this frail population? So we can see hypertension, obesity, and depression are the top 3 within that. As you change these particular filters at the top, or maybe you would like to be specifically looking at one ethnicity or a couple of ethnicities, but you can click on the graph to also change it. You don't always have to use the filters at the top. You'll see this dashboard update and change to show, depending on the selection, how all of that then looks. So now I've chosen the Asian British ethnicity group there. We've now see that all of these numbers are changing, and we've got a large number with 2 or 3 additional long-term conditions compared to our previous look where it was 2 or more were the majority of long-term conditions. Those type of long-term conditions have also changed now. So we're now seeing hypertension, obesity, and diabetes as our top 3 long-term condition areas within that frail population. So by using this dashboard and seeing how it dynamically changes depending on your selection, will start to give you different bits of information based on those cohorts that you're looking at. The next dashboard that has been developed is, scroll up a little bit, it's the clinical history and care dashboard. So the first thing I'm going to do before I move over, I'm just going to clear all my filters so we can start from a fresh point of view. And then we will move into the next dashboard. So in this dashboard, you can see that it's got a similar look and feel to it, but the graphs that we're looking at here are different, and we've got a different set of KPIs at the top. So you can see the EFS, so the Enhanced Frailty Service data, as it's not yet flowing through, we have no data for these particular KPIs. But what we can see on here is specifically around admissions, known to particular services, and some further information about data recorded with regards to place of death. So at the top then we can see for our population. So as I did earlier, I removed my filters, but we can add those back on and have a look at those if we're interested in particular cohorts. And we can see here that how many non-elective admissions for that cohort happened over time. So we're seeing, you know, a bit of a rise, as we may well expect over our winter months, a little drop then again in February, and again a big rise again in March. So those non-elective admissions and how that's impacting. We can change these and look at the number of falls over time. So again, by choosing to change this particular graph will change to look at the number of falls over time, but everything else stays in place. Okay, on the top right graph, we've got the number of A&E attendances over time, and then those with readmissions within 91 days of discharge. The bottom left, there's quite a number of options here. So this is who are these people? What services are you being seen within? What care plans are in place? Virtual ward admissions. That group of activity is showing here. So we can see by social care services, frailty, virtual ward admissions, patients with a care plan in date, and those percentage with out of date. And the additional pieces that we can do with these 2 bottom graphs here is look at this by borough, PCN, or practice. So if we look at health borough level, you can see this graph will change, and then you can see by borough. Obviously, as is said before, this Brent and Harrow currently. Break that down by PCN. And then it can also drill down to practice level 2. So if you're maybe working across a PCN and you want to understand where do those numbers break down to my practices, my suggestion here would be choose your PCN at the top first, and then it will just give you the practices for that PCN. Otherwise, you'll end up trying to pick out practices from multiple different types of PCN. So we'll show you that here. Okay. So then we got it at the practice level 2. On the right-hand side, we got patients with preferred place of death. So this means who's had that recorded on their GP system. Is that something that has been recorded? Do they have an end-of-life care plan in place? Do they have palliative care plan in place, or the universal care plan in place? So just numbers of patients with those things in place. So they're the 2 dashboards that currently are receiving data. We do have 2 more dashboards. We've got the EFS population comparison and the EFS impact on service, which at the moment isn't receiving any data into it, but I'm going to pull across a screenshot of what that will look like. Just to move this over into my screen. I'm going to make it a little bit bigger because it is from a document. So this is the EFS population comparison dashboard. So once the data starts flowing in, we expect to see 2 key pieces of information split in a number of ways. So we've got those who are referred to the EFS service and those that are stepped down, so basically on EFS or not on EFS. And then looking at that across a number of different areas, such as the number of referrals and step downs to EFS over time, percentage and distribution of the cohort by deprivation, percentage of the cohort by number of LTCs and those specific long-term conditions. So you see some real similarities to what we were looking at previously on the population page, but this is now about the EFS service. And then the second dashboard will look something like this when the data flows in. And again, looking at those who have been referred to the enhanced frailty service, how many of them, so what's our sort of usage of services before they went to EFS and then after they've been to EFS service. So has that had an impact? Has that EFS service helped reduce maybe the number of non-elective admissions? Has it reduced the number of A&E attendances or UTC attendances over time? And we can start to see whether that is increasing or decreasing during those previous and post introductions to EFS. That is at the population level. There is an additional dashboard for clinical staff who have direct purpose with a patient to be able to look at an individual patient record around this data. And I can show you very briefly what that would look like. I'm going to close this here and take you to our demo site so I don't share any actual patient information. So you just see how this then, once these cohorts and these populations have been identified, how can then something, take it to the next step? Who are these individuals? And then working out what the plan might be for those particular scenarios. So the Frailty Risk Escalation Radar is what we call this. And this will list all those patients who met that criteria in that population dashboard. It's only available to those who have a legitimate relationship with patients. So those working, say, for example, within a practice, they will only be able to see patients who are registered to that practice. They won't be able to get a wider view. So it's very much on the individual patient level page. So RAG-rated indicators. We've got in here the Frailty Risk Score, which is an agreed scoring that's been built along with this dashboard based on all of these different types of indicators across here. So this isn't just about your EFI, which we do have here. You've got your EFI classification, but there's an additional Frailty Risk Score that has been built specifically from this Frailty program to give that further indication. So there's some factors here about our attendances and to our acute services and falls, and also referrals. I won't go into too much detail. Then the next is the additional factors. So we've got social isolation, polypharmacy. Are they having lots of DNAs? Do they have dementia? What's their multimorbidity status? And then the final layer of that is, are they known to certain different services? Do they have a carer in place? What about their care plans? Some of these individuals have many care plans in place. Some of them don't have a lot. Some of them have them in place, but they're not in date. So they haven't been updated within the last 12 months. So really starting to identify individuals and things that you could do then for those actual individuals. So we start off at that population level, drill down, and then there's a tool here available for staff who would be dealing with the doing something with individuals on an individual basis. Okay, any questions on any of that?
Rachel, that's been really helpful, and thank you very much for putting the presentation together and sharing with us. Is the presentation, is there a Word or PowerPoint version of the presentation you can share and circulate with us?
So so I'll put my camera back on, bear with me. We have two pieces of collateral. So we've got a user guide that takes you through pretty much all those things that I've just mentioned. That's on our website, and there's also a video that will take you through that too. So there's two pieces there. It will give you a little bit more detail in some of those areas. So appreciate I have tried to fit this to time today.
Sure.
But yeah, I can share those links.
Okay, so before I bring anyone else in,